Can you please introduce yourself?
My name is Nicole Lønfeldt. I'm an associate professor at the University of Copenhagen in the Department of Psychology and Center for Social Data Science. I'm also a senior scientist at the Child and Adolescent Mental Health Center of the Capital Region of Denmark.
Who are your DCs and what do they do?
I have one DC. Her name is Katrine Drakos, and we're responsible for the mental health use case.
What motivated you to become involved in the alignAI project?
Well, I really agree with the objectives of the project: human-centered artificial intelligence, putting people first. I work with people, so this is it's the only thing that makes sense for me. And yes, and a close collaborator, Sneha Das, asked me if I wanted to be a part of the project. And since we have a very nice working relationship already, it felt very comfortable to enter the project.
What unique perspective or expertise does your group or institution bring to the alignAI network?
I would say our expertise within mental health and human development. Line and Sneha and I have been working for a number of years now on interdisciplinary projects that involve mental health in child and adolescent psychiatry, and technology or data science, and not only the mental health aspect of it, but also behavioral science aspect of it. So really using all aspects, or a lot of different aspects. So there's behavioral observation has been a large part of our projects that we continue to incorporate, and it's a basic skill or expertise from psychologists that we can contribute with.
How do you envision the use case of mental health contributing to the practical outcomes of this project?
So the way that I see the mental health use case contributing to the tangible outcomes of the project is, of course, with a product that promotes mental health, but also with the objectives and the values of the project of creating human-centered AI. So working within child and adolescent mental health, we're working with a population that is exposed to media, social media, and education. I mean, they're users in all three of the use cases. And the values that we have from mental health care is broadly applicable, and it applies to all three use cases and to the overarching goals of the project.
How do you balance guiding the overall research direction while allowing DCs the freedom to explore their own ideas?
Right. I see the supervisory role as one of guiding independent researchers. So in the beginning, they might need more help than they hopefully need at the end. And if that's the case, they're working more independently at the end. I think I've done my job. And that means giving them the freedom to pursue their interests. This will keep them committed to the project and ensure that they're finished in 3 years. If you can motivate them and capture their interests throughout the project, then I think this is what's true for any job, but particularly, in research.
What message would you want to share with those outside of academia who are concerned about the future of AI?
Yeah, I think the discourse in the popular media right now is very alarmist. And you have these two extremes. Either you have the people saying, just go for it. It's coming and you just have to prepare for it, I guess. Or they promote the positive possibilities and minimize the risks. But there's also the more maybe Silicon Valley approach to things, that you go for it and you break things and you find out later if it was a bad idea or if you need to pull some things back. I would tell the public that there's a middle way, and there are researchers and developers interested in creating artificial intelligence that helps humanity.
If alignAI is successful, what changes would you like to see in the broader AI ecosystem over the next decade or in the future?
Well, I think that alignAI offers an excellent opportunity for sectors like the one that I come from. The guardrails, or at least to start at obtaining the guardrails that are needed. There's a lot of potential in artificial intelligence, but there are also a lot of risks involved. And while we have in the medical field a system for vetting medical devices and testing pharmaceutical products, they don't fit this type of technology. And it seems in many areas of society we're running after the technology and retrospectively trying to protect the public. So it would be nice in some ways if we could get ahead of the ball.
Yeah, to be proactive in a sense.
To be proactive and not just wait for these huge society-changing, life-changing technologies until they're upon us and we see the effects of them, some good, some bad, before we start acting.
Thank you very much for these insights. They're very valuable, and thank you for your time.